Many of us are talking about healthcare reform. I mean real healthcare reform, where we're looking at a kind of system that works for us, that keeps us healthy, not one that depends on our getting sick and requiring a lot of technologies and pharmaceutical drugs to get us out of trouble. We're not dealing with the epidemic of chronic diseases that we need to, but we can if we shift the system. We're not dealing with the expensive costs that are involved, $2.3 trillion a year in the U.S. every year, but we can. And it requires a new system that's focused on wellness and prevention and nutrition and natural therapies, a system that we can take responsibility for ourselves. And there's a new kind of medicine that's been invented in the past 20 years that's called health medicine. Health because we want to focus on health, not focus on disease. And medicine not in the spirit of pharmaceutical drugs, but in the spirit of the tradition of the healing arts, using old, ancient, high-touch approaches to making people heal themselves. And we can do that. So when we're talking about health medicine, we're looking at strategies that are integrative, holistic, person-centered, and preventive. This is the new model. We've had experience with this now through the Health Medicine Forum, which is a nonprofit educational foundation that I founded in 1994, and have come up with a definition of what health medicine is really about. And so we're looking to work integratively, the first principle of health medicine, finding a way to include all disciplines that bring anything to the table that might support some kind of benefit for our patients. That's our obligation. We shouldn't be limiting our approach to healing to just one approach. It's confining, it's not scientific, and it really doesn't make much sense. So we need to find a way to cross-fertilize so that we understand what other disciplines do. We need to do more show and tell and work together and find out what these other disciplines are about so we can at least be knowledgeable about how they might possibly be included in some of the therapies that we could use in our treatment plans that have never been done before because we've never done this. So integrative healthcare is absolutely scientific and necessary. Secondly, holism. What does holism really mean? It's the inseparable nature of body, mind, emotion, and spirit. It's one thing. It's not four pieces. You can't take those pieces out of somebody and examine them under a microscope because they don't exist that way. So we should be looking at every aspect of what a human being is, every perspective of who we are. Look physically, biochemically, bioenergetically. Look at all the different approaches that are emotional and spiritual and even universal. A kind of integral approach to looking at what's going on with every individual person and how their particular situation melds and involves other people in their lives, their families and friends and society and country and universe. Thirdly, we should be doing therapies that patients believe in and want. We know how powerful the placebo effect is, and yet we categorically reject it because it's, quotes, not scientific, but actually it is scientific. It's just that we don't understand it. And it's not scientific to throw something out that we don't understand. In fact, it behooves us to study it and to use it as an outcome in the things that we do. So we should be using therapies that people believe in, and we should be finding ways to integrate those into as many different styles of healthcare that we can, so long as the patient's in agreement. And of course, lastly, we should be doing prevention. We need healthcare reform that's truly preventive. That'll save dollars. That'll keep people from getting sick. That'll keep us in a place where we can be well and enjoy our lives with full vitality. We deserve nothing less. We've been doing this style of healthcare now for about 10 years in a small clinic in Walnut Creek that's called the Health Medicine Center, where we bring practitioners of different disciplines together to work in a way where we can share our ideas and then create treatment protocols for patients that they want that involves all of who they are, body, mind, emotion, and spirit, and have had really good success. I think it's time to bring this model forward. It's time that we try and fund it. We need our Congress to fund it so that it becomes a level playing field with the insurance industries that are supporting mainly just Western medicine. If we do that and we apply these therapies, it makes so much sense a lot of the time in a system that is looking at the whole person. It's inevitable that we're going to have a system that takes care of us in a superior way. It's up to us. We can start this movement at the grassroots level as well Talk to your doctor. Talk to the healthcare practitioners. Encourage them to be thinking more locally and acting more globally. We can make the change. Health medicine is the medicine of the future.